Hello and welcome to another episode of the Rotator Cuff Expert. I'm Dr. Orcutt, and today we're going to talk about disability. This was a good question that was brought up on the comments on the YouTube channel, so I thought it would be worth it to take some time to go through this. I think this is going to be a two-parter because there's a lot of things to wade through and sort through as far as this topic after any surgery, any injury, but specifically we're going to talk about in regards to a rotator cuff repair or failed rotator cuff repair. But just like the other video we talked about as far as returning to work after rotator cuff repair. So please, if you haven't seen that video and you're interested, that's a good video to look at too. You know, what's the likelihood of me be able to go back to work? There is certainly a chance that you're not going to be able to go back to work after having a rotator cuff tear and having a rotator cuff repair, depending on what your work is, right? Obviously, if you're more manual labor, more physical, there's an increased risk of not being able to get back to work after a rotator cuff repair. Either it doesn't heal or it doesn't heal strong enough for you to be able to get back to that normal duty. There's a few issues here. And some of this will cross lines. If you hurt yourself at work, it's a different thing than if you hurt yourself in your backyard. If you got hurt in a car accident, well, that's a different thing than if you got hurt in your backyard or if you got hurt at work. But for simplicity, we're going to start with that this happened in your backyard, right? You slipped down the stairs, try to hold yourself, tore your rotator cuff, you got surgery, you're getting through this, you're 6 weeks out, you're doing okay, 3 months out, you're not doing okay, or you're doing okay, but you're not doing well enough to get back to your job. And so in a regular situation, again, not with the other kind of potential lawsuits of workers' comp or personal injury, we talk about, well, initially what almost everybody has short-term disability. Short-term disability is usually 3 months. It's short-term disability, again, this is in the US, this is in Georgia, it may be different other places, but just the general concept is you're gonna have, if you have a short-term disability insurance through your work, again, this is usually through your work, not in a governmental agency, you have a short-term disability policy through your work, then often you will be able to not do anything or not work for 3 months, right? You may decide to go back to work early. Let's say oftentimes, most times, we'll see you not work for 2 weeks if you have a really simple job in that you don't need to use your arms so much and you can get someone to drive you to work. So 2 weeks, maybe you can go back to work in modified duty. In a bigger, more significant, maybe you're not ready and so you go back to work at 6 weeks, 6 or 7 weeks after you can drive, you go to work then. And again, that would be a low intensity job as far as how hard your shoulder has to work. That would often be 6 or 7 weeks after surgery and go back to that job. If you have a high necessity for lifting and moving your shoulder, then oftentimes in general, it'll be really 3 months. 3 months before you get back to work. That works reasonably well because that's actually how long short-term disability usually is. If you go beyond that, there's some other issues that we have to worry about. We may have to do something different and you may not get paid to going back until you go back to work. And honestly, in the beginning, depending on your short-term disability insurance, you may not get paid your normal salary, especially if you do overtime and stuff like that. And so although short-term disability can be very helpful, oftentimes it's not replacing all of your salary. And again, this is just an injury without any legal or workers' comp, right? The next thing is long-term disability. So sometimes, depending on the job, you can have long-term disability where they will pay you for long-term if you have that insurance. Oftentimes, long-term disability is a policy that you may have, that your job may have for you, or you actually may actually have a policy like that. Like for instance, for me, I have a long-term, I don't have any short-term disability, but I do have a long-term policy. So if I was to, cut my hand off with a lawnmower and I couldn't go back to work, I have a long-term disability policy that I pay each year, right? And so that may be a possibility too. There's not many people who actually pay for that long-term disability policy because it's expensive. So there may be some people who have it, but lots of people don't have that long-term disability policy. If you don't, then you get stuck into what do you do next. And so you can retrain, right? If you can't go back to work, you say, okay, well, I don't have any short-term disability left. I don't have any long-term disability benefits. I can retrain. I can't do my job, but maybe I can do something else. Maybe there's something else that I can do that'll make up for the job that I can't do. And that would be a modified duty job, right? Either your company may say, yeah, you come back and yeah, you don't have to do the heavy lifting. Now you can just be the supervisor, and you may be able to modify your duty that way and go back to your job. A lot has to do with what your job is. A lot has to do with where you are in the level of job. Sorry to say, but how great of an employee you are. If you're a great employee, you showed up every day for 10 years, and now you can't, and you have some other skills that they can use, then oftentimes they might transfer you over into that modified duty. This is where we're going to stop today. So because we need to talk about modified duty and retraining a little bit more, but probably more importantly, we need to talk about what happens in a car accident, what happens in a workers' comp, right? And what do we talk about when we talk about long-term permanent disability? And what does that mean? How do we get there? So we'll talk about that next time. The key thing is to know that each is a little bit different. You know, you get hurt in a car accident, you have a lawyer involved. If you get hurt at work, you may or may not have a lawyer involved, but there's different levels of disability. And then there's SSI, Social Security disability, and that is from the government. And we'll talk about how you get that because it's not a doctor's decision for a long-term SSI. It's actually a court decision. And so we'll go through that next time. We all hope that our rotator cuff repair heals well enough for us to get back to work, but we know sometimes it doesn't. So there are mechanisms for the short term and the long term, but it's complicated. So hopefully this makes some sense to you, and we can go over it again when we start the next session. I try not to go over 8 minutes if I don't have to, because it just gets too long and boring and people don't check out. So the second will be a little bit different, kind of talking about SSI and permanent disability. This will be part one. We'll do part two. Again, remember, Rotator Cuff Expert, remember mybodyprotector.com. We got some additional information over there. And if you have any comments, thoughts, questions, please use them. Please subscribe, and we'll talk to you next time about part two and disability after failed rotator cuff repair. Thanks.